If you have a tooth you're going to lose, it has to be removed, and you want to get a dental implant. Can any dentist remove a tooth and then place an implant? Is there something important that needs to be done during the surgery so that the implant will work later on? It's very important that you listen to this video because yes, there are definitely many things to do during the surgery so that the implant will work later, and in this video, I'm going to explain them to you. A patient who comes from Switzerland just visited us. In Switzerland, a molar hurt her a lot, and they didn't just remove it, they ripped it out. It's horrible. Why? Because they remove the molar, insert some forceps, start applying pressure, they rip it out, and instead of saving and preserving that socket, the socket is where the hole is left, where the molar was, and where the implant will go. Instead of doing something so that the socket would close nicely and we'd be left with great bone, they left it empty, put in 2 sutures, and sent her home. Obviously, that was reabsorbed, and she lost a lot of bone that would have been very valuable to us. Now, friends, in some cases, that levering motion is necessary, since the anatomy of some teeth requires us to do a little bit of wrist movement. But we also have techniques for that, like sectioning the teeth. We can cut the teeth in such a way that each root will come out independently, and that makes the surgery less invasive for the patient, and especially for the bone surrounding the teeth. I insist, sometimes we have no other choice but to make the movement, but we must try to limit it in most cases to preserve the socket correctly. What do we normally have to do so that the bone is perfect for a dental implant? I'm going to explain it to you. Number 1, the dental extraction has to be an extraction done with a lot of care. The tooth must be removed with extreme care. You have to keep very much in mind that that will be the place or will be the home for a dental implant later on. Therefore, if you insert forceps and start pulling it hard and leveraging it, you're going to open that bone and you can fracture the walls, and then the bone collapses and is lost. In fact, it often happens with patients that if you remove the tooth very aggressively, they lose the bone. So, number 1, the extraction has to be done with great care, very delicately, to preserve the socket. That word, remember it, it's very important, alveolar preservation. Once you've removed the tooth and you've done it with great care, a hole is left where the roots were. That hole needs to be filled. We have several options to fill it. Number 1, with plasma-rich and growth factors. That is obtained from your blood, it's centrifuged and placed inside the socket. What is this done for? So that the platelets that are concentrated there and the growth factors work and greatly improve that socket. There, if we really have good preservation, the bone grows beautifully, and sometimes a bone graft isn't even required. When the cavity is large and we don't have some of the walls, sometimes it's decided to place a bone graft so that those walls are better preserved, and the implant can be placed in a much safer way. Third, a barrier called a membrane can also be used, either made of titanium or collagen. What for? So that the bone doesn't come out of there, so that the bone stays and a very nice bone surface is formed, and the implant can be placed later. The worst mistake is to remove the tooth and do absolutely nothing. Why? Because sometimes nature is very kind to us, and it rebuilds beautifully. There are patients who really have no graft or anything, and they're incredible. But many other patients do suffer from what's called bone collapse, and if this bone wall isn't protected, it's lost. And then it becomes very expensive, very traumatic, and very difficult to recover all that bone. Sometimes it can be done, but as I said, it involves more expense, more time, a lot more time, and discomfort for the patient that could be avoided from the time of extraction. Once it is placed, whether it's the plasma, the graft, or the membrane, you have to wait. How long? Well, it depends. If the walls are very nice, there isn't much collapse, and the patient is in good health, the implant could be placed in 2 or 3 months. Sometimes when the gap is very large, when several walls had to be rebuilt, you have to wait up to 6 or even 8 months to be able to place the implant properly. And maybe here you might say, but doctor, people are saying there are implants that don't require a bone graft and can be placed in collapsed bone. Okay, number 1, we're talking about from the moment of extraction. Right now, I'm talking about before that collapse happens, which is when they're removing your tooth, and that's why it's important to avoid losing the bone. If you've already lost it, we have other solutions. You know, I'm not a big fan of those implants. I've already told you in videos that last 30-40 minutes. I'm not going to mention it in this video. I'll leave a link over here if you want to go see it. I don't agree with those implants, and I have my reasons, okay? But the ideal thing is that if they're just removing your tooth, you don't fall into that bone loss. And that's why I'm explaining this. Now, if your bone is ready and everything is perfect, we wait, as I said, 8 months in the case of a bone graft. Sometimes when it's a maxillary sinus lift, the patient may have to wait up to 8 months to a year for that bone to form properly. But the wait is worth it because when the implant is placed, the implant has very good bone support, and we can have something as close as possible to nature, which is the tooth, with a good, thick implant that can withstand the chewing forces. Now, if you're not going to get a dental implant, is it worth placing a bone graft? Is it worth saving that socket I'm telling you about? Of course it is. And I'm going to give you several reasons. The first and most important one, if you're not going to get a dental implant, maybe you don't want to get it today because you're scared, because you have doubts, but tomorrow, if you do want to get it, you're going to regret having lost that bone. Number one. Number two, if you're not going to get an implant, okay, but you're going to have to get something, a removable appliance, a Maryland bridge, some kind of bridge. And what's better than for that bridge, that removable appliance, to have a good bone shape? Because remember, the bone gives shape to the gum. If the bone collapses, the gum collapses, and then you'll see a larger gap and the teeth look gigantic, or there's a hole where food gets trapped. So even if you're not going to get a dental implant, it's a very good idea to do an extraction with socket preservation, an extraction that is done carefully to think about the future of the restoration. Friends, today's dentistry has to be done thinking about the future. What I'm doing today should have an effect in 10, 15, 20 years, and a positive effect. Therefore, it's time for us to stop. Why? Well, because we don't pay enough attention to patients, or sometimes we just do it as quickly as possible, or due to a lack of knowledge. There's also the economic side, and we can talk a bit about that. An extraction with alveolar preservation doesn't necessarily have to be expensive. It can be done very well, it can be done with care, and preserve the walls. If you had a collapse, well, yes, it will cost a bit more to preserve it. But what will cost more, my friends? Preserving the socket that is fine right now, or losing that bone and then wanting to recover it? Do the math, and believe me, it's worth investing in keeping your body's natural bone, rather than losing it and later saying, well, I lost it because I couldn't afford it. And then it will cost you double or triple to recover it, or you'll have many problems with your restoration. Because what I'm telling you will prevent problems like food getting stuck, it looking very ugly, having poor function, not being able to place anything, and living your whole life without being able to chew. Think about it, do the math, and yes, it's worth it. So I hope this video has clarified what alveolar preservation is and how important it is to have an extraction done by someone who understands this. Look for dentists who understand alveolar preservation and who think ahead about what comes after the teeth are removed. Removing the tooth is the first step of the restoration. Let's not just pull teeth, let's do extractions preserving the socket, and the future of the restorations will be much better for our patients. Friends, subscribe to the channel, share this video with someone who is having a molar removed so they have some idea of what to expect, and we'll see you in the next video. Be very, very well. Sorry, let's take it again from a patient arrived, okay? Okay.